Okay, three, two.
Hello everybody, Dr. Weegriff here at Pure Plastic Surgery for another Thursday Thoughts. Today we're going to be going over something that a lot of people have questions about and what their treatment options are. That is skin in different parts of your body, but particularly your buttock or your posterior thighs. And if you have lumpy, bumpy appearance there, what is causing that? And what treatment options do we have for it? And so first of all, we have to identify what is the cause of that. There's a few different things that it could be. It could be skin laxity, which is just occurs over time with aging, fluctuations in weight and weight loss. Or it can be something like cellulite, which is actually connective tissue tethering the superficial skin down to deeper structures that causes dimpling of the skin. So first of all, we need to identify which one of those problems it is, or is it a combination of both, which oftentimes it is. So to identify whether you have skin laxity or cellulite, the best way to do it is by identifying some of those dimples on your butt or posterior thigh and gently pulling up on the skin above it. If it smooths out, it's most likely skin laxity rather than cellulite. If you pull up on the skin just by gently pushing up on it and it's still dimpling, then it's more likely to be cellulite. So we have treatment options for both of these issues here at Pure Plastic Surgery. They're non-invasive, they can be done in the aesthetic center. They can also be done in combination with some of the other surgeries we do here when you're under general anesthesia. So first of all, we'll talk about skin laxity. If that's your primary problem, one of the things we can do for it is a radiofrequency treatment called Morpheus. And this is a special handpiece that uses radiofrequency with a bunch of small little needles that goes into the skin, heats up the skin and underlying connective tissue and causes a mild contraction, tightening the skin and alleviating the issues related to skin laxity. So that's the Morpheus procedure. It can be done on the face too. There's two different handpieces, one for the face and one for different parts of the body. So that's a great option for skin laxity. The other problem that we've fought for a long time in plastic surgery and different, dermatology, other specialties and how to treat is cellulite. And again, cellulite is when there's tethering of the superficial skin to deeper connective tissue that causes that dimpling. And we've tried several different things throughout the years on how to treat cellulite, and nothing was really that effective or had long-term results. A few years ago, we were injecting these areas with a collagenase that would break down those things, but it was causing issues like hyperpigmentation. But more recently, a company called Avali came out with a device to do a minimally invasive little procedure to treat those areas of cellulite. So if you come and get evaluated by one of us, and we see that it is cellulite, this device is able to locally treat those little areas of tethering. How we're able to do that is this special wand has a little light on the top of it that we can actually see underneath your skin to make sure we're at the right level. We go up to the area where the tethering is, we deploy one of these buttons, and there's a little barb that comes out that we can hook and feel the area of connection, and we can see it tether down exactly where the dimple is, and then we deploy a small blade that cuts it. We do that a few times, a few passes for each one of those areas of cellulite, and we're able to permanently get rid of that area of cellulite that's been plaguing you for a long time. So this, again, is a treatment that's more recent over the last year or two, and it's had a lot of success with patients, and we're excited to be able to offer it to our patients to really help them improve these areas where we previously didn't have a great tool for it. Do we have any questions about either of the things we talked about?
Just 1 second. Okay. Okay, this is about Avali and BBL. If they can be done at the same time under the same anesthesia.
That's a great question, and my answer would be is if it's one or two very small areas, we can consider doing that. But if there's multiple areas that we're treating at the same time, because this is cutting that connective tissue that's tethering the skin, It could actually lead to the opposite problem if we were to fat graft right away and we treated a bunch of areas with the Avelli. You could have little areas of the skin bubbling up. So we actually like to treat the cellulite beforehand and then come back and do the BBL at a later time.
Okay, I got a question here at TikTok and say for the stretch marks, this is available?
Neither of these options are great for stretch marks. They're not going to make stretch marks go away. Stretch marks are a sign of skin laxity. And so if skin laxity is one of the issues you're having, the area you're concerned about, the Morpheus is a good option for causing some skin tightening in those areas. But fortunately, stretch marks are one of those other very difficult things for us to treat without cutting them out, which would of course result in a scar. So things like tummy tucks and other things that remove a bunch of stretch marks at one time are a great option for them if that's the area you have your stretch marks.
How long is the downtime for the Avelli?
You're up and about the next day and you just need to take it easy for a few days. You can have some bruising, swelling, and some localized pain, but that all gets better within a week or two. And so you're really, it's minimal downtime.
Okay, we're back on TikTok. We're 122 people right now, and the question still with the Avelli, and she asked if there are bruises after the procedure.
Yes.
How are the bruises after the procedure?
You can definitely have bruising after the procedure. They can persist up to 2 or 3 weeks, but it's typically 1 week of bruising that really starts to get better after that.
Okay, how many times I should go to have this procedure done?
So the Avelli, for each area that we treat, it should only be 1 time. We should be able to treat that area and see that it releases, and that should be done. You do not have to treat that area again. For treatments like the Morpheus, where we're doing the skin tightening, it often requires more than 1 treatment, anywhere from 2 to 4 treatments depending on how much tightening you need to achieve. And so, we can set you up with different plans here after we evaluate you and let you know how many times we think it would be necessary.
Okay, the Melissa said, hi, I'm here in South Carolina. So
Hello, Melissa.
that's it, and we're done.
All right, thank you, everybody. If you're interested in our consultation, please contact us here at pureplasticsurgery.com. We also have our aesthetic center that is part of Pure Plastic Surgery. So I also offer these procedures, but we also have some PAs and nurse practitioners that offer these procedures under local in the office as well. So feel free to reach out to us. And I think we do have a promotion with the aesthetic center right now, and contact us for the details on that. Everybody have a great day.